How does the United Nations assess the state of health of children all over the world? And how do they collect all the information they need to report on child issues? What factors affect child health in different countries? And what are the common causes of childhood death worldwide? How do governments and aid agencies plan for long-term child development projects? And how can they assess the effectiveness of those projects?
Dawn, and as the sun breaks through the piercing chill of night on the plain outside Coram, it lights up a biblical famine, now in the 20th century. This place, say workers here, is the closest thing to hell on earth.
At least 20,000 people are missing at Cox's Bazar. The cyclone tore into it for 9 hours. Islands nearby, which had populations of tens of thousands, are still covered by 15 feet of water.
Many of these boys have spent much of their lives living and sleeping in this crowded, dingy room. It's warm, but it's filthy. The children are undernourished, their skins covered in sores and fleas. The children are naked because it's easier to clean them. Any clothes they wear soon become soiled.
A mountain range on the Turkish-Iraqi border, desolate, often freezing, but for several terrible days, home to more than 200,000 people. They sat and suffered in conditions which worsened by the hour, the human consequence of an uprising that failed.
From media reports alone, it might appear that people in developing countries, especially children, only suffer at times of natural or man-made disasters. But children suffer even in times of apparent stability. The United Nations Children's Fund, UNICEF, reports that 250,000 of the world's young children die every week.
It is unconscionable that as the decade of the 1990s start, that some 40,000 children are still dying every day, and tens of thousands of children are being crippled for life every day. Every 3 days, we have the toll equivalent to a Hiroshima disaster.
UNICEF calls this grim picture the silent emergency. And apart from humanitarian grounds, there are good reasons for promoting child development.
Development is a very long-term business, and the productivity of the next generation of workers is one of the key factors in the long-term prospects of a developing country. But the workers of tomorrow are the children of today.
UNICEF's challenge is to work with governments and aid agencies to reduce childhood deaths and to improve child health. But how can they achieve this? In 1989, the UNICEF Convention on the Rights of the Child established a charter for children, proposing for the first time standards for health and protection against exploitation. And in September 1990, UNICEF hosted the first World Summit for Children. Heads of state from 159 countries met to agree plans for ending mass malnutrition, preventable diseases, and widespread illiteracy.
Saving one child is a miracle. As world leaders, we can realize such miracles, and then we can count them in millions.
One of the keystones in UNICEF's monitoring of child issues worldwide is its annual report, The State of the World's Children. This gathers together statistics about child health in over 120 countries worldwide, ranging from the very poorest developing areas to the richest superpowers.
The State of the World's Children report has become a very important source of information as to what is the status regarding programs for children, whether they are in Africa, in Asia, Latin America, or Europe.
One of the key factors of the report is the presentation of statistics for human issues instead of purely economic data.
I think over the last 20 years, people working in the development business, people in developing countries, have realized that increase in income per se is not always a very good indicator of human development.
In earlier decades, say in the 1950s and 60s, we concentrated on economic growth And we assumed that the economic growth would more or less automatically trickle down to poorer people, that everyone would benefit.
There are many examples of countries which have low per capita incomes, such as Korea, Sri Lanka, Costa Rica, parts of India like Kerala and Tamil Nadu in the south, where per capita incomes are very low, but in terms of human development, whether it's female literacy, life expectancy, or infant mortality rate, they compare very favourably with places in the Middle East, for example, where they have very high incomes because of oil revenue, but infant mortality rates and female literacy rates can be quite low.
The report's tables list information about nutrition, quoting figures about food production, malnourishment, and breastfeeding. There's information about health. How many people have access to clean water and hospitals? And how many children have been immunized against preventable diseases? And there are details of education. How many people go to school? How many have access to radio and television? And how many can read? Compiling the report is a mammoth task, requiring worldwide cooperation.
This report takes at least 12 months to put together, and it's a worldwide global cooperation between our offices in individual countries and information that is gathered from academic circles, from non-governmental organizations, and governments worldwide.
The key advantage of the UNICEF report is that it presents its statistics in a uniform format, but the data it contains are not of uniform quality because compiling statistics about developing countries can present severe problems.
Frequently one has no idea what the population is or exactly where it is, and there are no current maps or maps that go back 50 or 60 years in some cases. Sampling is therefore extremely difficult and requires, to a certain extent, shortcut and compromise approaches. The distances can be very long and the terrain sometimes very bad. At the extreme, we've been using helicopters in parts of East Africa to do surveys that simply could not be done on the ground.
And in many places there are cultural differences, which make collecting human data especially difficult.
Many cultures in the world don't exactly count the ages of their children. Probably it's more common not to know your age in this world than to know it exactly. In terms of assessing the nutritional status of a child, that creates a problem because one needs a fixed point against which one can relate growth.
Statistics are being gathered constantly, which add to the worldwide picture of child health. The state of the world's children gives a snapshot of the factors which affect children the world over and indicates what work needs to be done to improve their lives. But it's only a snapshot. It's not the detailed data that are needed to make real policy decisions.
One of the problems with country-based data is that they are generalized, and therefore do not give you specific data about different regions or different districts, or even different areas in different districts. And therefore it becomes important to try and generate information, statistics at the local level.
At any one point, statistics have got to be taken with some degree of caution, because when it comes to developing countries, one is dealing with a challenge in collecting statistics, so that the figures that we have in the report generally are ballpark figures, nearest estimates as to the best of our judgment what is the situation of women and children in individual countries.
Good afternoon, Save the Children.
The users of development statistics include aid agencies like Save the Children Fund and Oxfam, and governments of developing countries.
Economic statistics and social statistics are used in development plans. Suppose we want to prepare a 5-year development plan or a 10-year development plan, we need to have projections of what economic condition or social condition will be in the future, given this present set of statistics that we have.
In Britain, the Overseas Development Administration is responsible for managing the government's official overseas aid programme.
It's true that in most countries, even some of the least developed, there is a wealth of existing statistics. One of the problems that we have is very often that those figures are contradictory, and we have to try to assess what is the best overall balance and which figures present the best approximation to reality.
Any organisation involved in development work will need to commit many millions of pounds to its projects. It's therefore essential to have more than just a simple descriptive analysis of the situation in a developing area, despite the problems in using statistics.
It's very difficult to use descriptive information to convince another person that what you're saying is true. These people in Africa are very poor. What does poor mean, really? Well, one can add a bit by describing the situation in which they live. Much easier to describe it in quantitative terms.
A descriptive approach is useful to form a broad outline, but if we wish to monitor the impact of a particular programme or the investments we're making in terms of money and time, human resources, it is important to have a more detailed analysis of the impact of that programme.
But there are times when detailed statistics about a particular region may be too difficult to obtain.
It's much easier to obtain the qualitative statistics, where you might do a quick visit to an area and gain the general impression about the health condition of the people living in that area, than taking a long time carrying out laborious surveys, which might give you accurate information, but which are pretty expensive.
Development statistics help you to compare the worldwide distribution of different indicators, like health and access to clean water, to see whether there is a relationship between them. This is essential to development work. It allows agencies to identify particular variables that can be measured to predict the state of child health. One commonly used indicator is the infant mortality rate. This measures the number of children who die before the age of 1 for every 1,000 live births. A scattergram is used to investigate the correlation of infant mortality with other variables. Some variables may show a weak relation with infant mortality, while others show a much stronger one. The relationship may be linear, or it can be based on a curve. But a correlation between two variables does not necessarily imply that one causes the other.
Clearly the fact that there's a relationship between two variables doesn't mean to say that one is cause and effect. For example, there was a study done in Central America a few years ago which showed that in one village, people who owned television sets, a small number of people, didn't have severely malnourished children. Now, the question then is, if the poor people had acquired television sets, would the malnutrition of their children have suddenly disappeared? Well, obviously not. And all one is saying, really, is that possession of a television set means you're probably richer, and you probably feed your children better.
Correlations that are established, let's say, that are maybe quite well established in Kenya, which is a statistically relatively advanced country in Africa. Well, those correlations may not necessarily apply, say, in Uganda or in the Chad, where you may have very different culture, different situations, different food for children, and so forth.
But the study of correlations may suggest some surprising ways of improving child health.
There are a number of other indicators which give us some idea about mortality rates. Income is probably one of the poorest. A much better prediction is education generally, and specifically female education. And of all the indicators that have been measured over the years, female education is probably the best single indicator of infant mortality rate.
Even when a correlation is well established, there are still social issues to consider.
One of the problems with measuring water availability or with measuring the availability of toilets and latrines, for example, is that although it is relatively easy to measure whether people have access to clean water, it's not so easy to find out whether people are actually utilising that water. And although the water may be clean when it comes out of the village pump, by the time it's been put into a dirty container and then transferred within the house into another container which has not been cleaned, and somebody has poured it out into a bowl without washing their hands, the water may be as polluted as if it was drawn from the village pond to start off with.
Although great care is needed when analysing correlations, it's an essential part of development work.
Correlations are particularly tricky when you deal with development problems, because essentially development is a question of what we call circular causation. A causes B, but B in turn has a backlash effect on A. It can be a vicious circle going downhill, or it can be a virtuous circle where one improvement feeds upon itself. Development typically is a process in which events feed upon themselves.
Development projects are by their very nature expensive and long-term. It's essential to have statistical techniques which allow the relationships involved to be summarized easily. One such technique is line fitting, or regression, which allows you to draw a straight line through a collection of data points.
Regression has the advantage of summarizing a very complicated relationship. Typically, you have a very, very large amount of data with which you're using to try and identify a relationship between two variables. And what the regression technique does is to provide a summary, if you like, of the relationship between the two variables, taking many, many observations on those variables.
Whereas correlation can be used to identify variables that are related to child health, line fitting can sometimes be used to quantify the effects of changing those variables.
Suppose that the government decides in a developing country they wish to halve infant mortality over a 10-year period. Now, how are they going to achieve that? Well, one way of achieving that would be to improve literacy of women. Now, that has implications for education expenditure. Now, your regression relationship connecting literacy to infant mortality will enable you to translate the target of cutting infant mortality by 1/2 back to what that implies for your target on literacy, and then elsewhere in your planning service you will be able to translate the literacy back to what is required for expenditure on education.
But in practice, there are big problems in doing this analysis accurately enough to be useful. You need to run a major survey to collect lots of accurate data about individual people.
The great mass of statistics, though, with a few exceptions. There's some quite good census statistics around, for example. But with those exceptions, are worth less. They are virtually meaningless as statistics. They are qualitative statements.
But development organizations do use statistics for evaluating projects. And there's a wider use as well, to justify to governments and to the public which funds them that they're using their money in the most effective way.
If you say 150, it's true enough for the purpose, which is convincing a politician that things in that country are really not very good, and infant mortality is a very graphic description of that. All you're asking the politician to do is to shell out some money. So that the usefulness of a statistic is very much related to the purpose to which you intend to put it.
In the past, investment may have been to build a hospital, and the completion of that hospital may have been enough in itself. What we now realize is that building hospitals or training health workers in themselves is not enough, because that may say nothing about the long-term objective, which is to improve quality of life, to improve the standard of health, and to reduce sickness and death.
I think people are becoming much more aware now that hospitals have running costs, that they have salary bills to be met, that they have drugs to be supplied, that the buildings fall down and have to be repaired, and that when you look at somebody who claims to have built a hospital, the real question that you should be asking, that they should be giving you the facts before you ask, is what does it cost to run, and who's going to pay that running cost?
The statistical techniques of correlation and line fitting are important, but the factors affecting development are very complex, and it's almost impossible to isolate the effect of one variable alone, particularly if the data may be unreliable.
The most literate mother without food will not be able to avoid infant mortality. So it's important in the regression analysis to be able to work out what is the independent effect of nutrition alongside literacy in influencing the infant mortality.
It's almost impossible to say with any degree of conviction that the cause of a particular problem is one specific event. Most indicators, whether it's literacy or income or child death, are influenced by many different variables, and it is very rarely possible to say that A caused B.
Statistics is just a tool used to interpret certain situations using numbers, because numbers by themselves mean nothing.
In the aid world, especially with the big agencies, the agencies which are much bigger than Oxfam, the multilateral agencies, and also the UN agencies, there's an obsession with statistics, and if the statistics are not accurate or they are not available, then the intervention is delayed.
The only statistics that really are useful are statistics where their origin is known, where the way in which they were collected is known, where their limitations are known, and where some judgment can be made about what they actually represent, where they fit in.
20,000 African children are wasted every day. What channels do we use to bring that human story forward to the public? Therefore, the report is a mixture of statistics on the one hand, but the human dimension, the human tragedy that is behind statistics, because statistics alone, unfortunately, have lost their impact.
I think the responsibility of statisticians and the duty of statistics is, given the information that we have available, however poor, however it is, what is the best use we can make of that information to ensure that the effort we do make, the resources that we do spend, have the best possible impact, and how can we optimize our chances of success? I think that is the challenge.